I carry in my pockets 2 challenge coins that I got from 2 different patients. One was a survivor of COVID, and one was not a survivor.
Coming into a shift, whether it was morning shift, whether it was afternoon, or even a night shift, and seeing every bed occupied, including hallway beds, was quite daunting to us.
Just felt like you were in a war zone. It felt like there were literally bullets flying past you, and we are in pure disaster.
We didn't really know much about COVID and what it was. I didn't know really how I would come into a patient's room, you know, having to wear the full protective equipment, and it's a scary thing.
We communicated with the patients who were in COVID isolation and with their families. We use technology where the patients can speak to their families via phone or video.
Oftentimes patients would come with family members or other loved ones that would wait in the parking lots. It was not unusual to see me walking in and out of the emergency department a countless number of times just to go out to that parking lot or speak to somebody at the front door in regards to their loved one's status and what we were going to be doing.
We had to many times put ourselves first, which is not normal for nurses or respiratory therapists, any of us.
It was scary at times of feeling like I'm going to get COVID. We relied on each other and just went in the rooms and combine our care for the patient. Hey, we're going to bring your lunch at this time with your meds, and so we weren't running in and out all the time.
You did your best and you protected yourself, so you would stay healthy and be there for these patients, whatever you could do.
It was very, very difficult to come home sometimes.
I had to have a change of clothes in my car, and then as I approached the house and get in the garage, I actually stripped down. There was no contact with me and my family.
We didn't know, is it on our clothes? Are we going home? Am I going to bring this to my family?
There was a lot of sad stories, but there was a lot of positive stories, and you don't always remember the names, but you remember the faces. And there's quite a few patients that they survived the COVID, and they've got to go home.
I think what's most important to remember is how the healthcare field, especially frontline workers, banded together.
The biggest silver lining is to know that my team and I will be there for each other no matter what.
Perseverance and the strength of people that stayed together during this pandemic, as hard as it was, keep going no matter what.
I think if we can remember those folks that suffered losing their lives, but also remember all the people that we were able to help and how we got through this pandemic, that is a true testament to the memory of what occurred during COVID-19.
You'll see me walking in the hallways, rubbing them in my pockets. And I do not come to work a day without them.